Welcome to Dundee FRCS ENT VIVA course. I thought of making this video to give some instructions to the faculties and delegates. As you know, it is a hybrid course, so which means some of you can attend virtually, and the physical course will happen at Queen's Hotel Dundee, which is 2 minutes away from Dundee railway station. So we expect everyone to join virtually through the Zoom, whether you are in-house or in physical or remote faculty. This is the same link, which you can see as zoom.us. If you click the link, it will take you directly to the meeting. And if not, if you're using the app, you can enter the meeting ID and the passcode. For Wi-Fi, Queen's Hotel provides its own Wi-Fi. It is the password is book direct, all of or lowercase. I'll come and explain the rest of the joining breakout rooms at a later point. So this course is mainly on 2 days, usually Monday and Tuesday, but we have moved most of the lectures before the main course to improve the feedback and also reduce the faculty as well as delegate fatigue. So on this Tuesday, I will go through the head and neck lectures, and the following day, the rhinology, and the following day, otology. Sometimes we send the pre-recorded lectures. I would kindly request the faculty to make sure whether they are available to provide the lectures in the evenings. Usually starts at 6:30 p.m. and goes up to 8:30 p.m., particularly after their work. We use the same link, Zoom link, as a username and password. So the meeting, same Zoom link will be used for pre-lectures as well as day 1 course as well as a day 2 main course. So coming to the day 1, it starts at 8:15. Usually we have an opening talk with a pediatric ENT talk through online. And for in-house audiences, it will be projected in the Queen's Hotel so that you can hear better. The whole day, day 1 is dedicated for Viva. So in this case, we have almost 9 stations, which includes otology 1, otology 2, rhinology 1, 2, pediatric 1 and pediatric 2, head and neck 1 and head and neck 2. We have included one more audiology station. In real exam, you will not have a separate audiology station, but this it is to improve your knowledge. It is part of otology training. As you can see, usually there may be one and maybe more than one faculty in each stations. So they try and alternate their Viva practice. Some of the faculties are in-house, some of the faculties are online. When you see in the Queen's Hotel, if there is no faculty in the room, it means both faculties are online. We will try and provide a laptop or iPad in that unmanned station. But if there is no laptops or available, you can use your own iPad or a laptop or even a smartphone that worked well during the last few courses. It gives you better clarity and good audio and video function. So remember, some of the stations, the faculties fully virtual. Right. So coming to the table, as I mentioned, day one is dedicated for Viva. All of you will go through the main stations, and it starts at around 9:10 and finish at 4:30. It's 10 rounds. For example, if you follow on the top, these are the delegates. If you follow the delegates one, they go through all the stations, and please make sure you follow that timetable. Don't try and swap or skip. It causes a lot of disturbances to the other delegate and some faculties as well. The red letters means you're passively observing, and the black letters is the one you're actually participating. It is very important you follow that one. The reason we put that one, so we have, as I said, is we have 2 stations. You actively participate in one, and the other station you will be observing. So we try to maximize your learning opportunity. That's why we have designed the rota in this manner. You also have a 1 rest station, everyone. So if you look at that one, before the coffee break, 3 stations. After the coffee break, 2 stations. So after the lunch, you will have another 5 rounds, and the course finish at 4:30. And that's about the day one. In every section, it is designed for 5 questions or 5 stations. In real exam, you'll have a 6, but because of the time constraint, we have reduced to 5 stations, and they will give you the feedback for the last 10 minutes. So it is graded similar to the exams, like 8 is the excellent, and 4, 5, 6, 7, 8. So that it depends upon how you perform. Try and ask the faculties about your grading. That will be useful. So if there is more than 1 faculties, they try and alternate while one faculty is asking or initiating the conversation. The other faculty is observing and probably marking that same. That's day 1. And day 2, it starts at 8:30. Usually we have a talks about the communication skills, and then followed by clinical examination and communication skills. So it follows a different timetable. Again, we'll try and produce real cases, otology, rhinology, and head and neck. Sometimes it's really hard to get the pediatric cases, so we may use simulations. Even in other cases, if you don't get cases, a faculty will produce some slides or videos, and then from that, they start the conversation more examination based rather than like a Viva. They focus more on examination and coming to the diagnosis. We do have a good bunch of cases, but sometimes on the day, some of the patients may not turn up. It happens in the true exam as well. So on day 2, the course usually finish at kind of 2 o'clock. So you can catch your train especially for long distance delegates and faculties. That's why we have finished the course at 2 o'clock. And this is the timetable for the day 2. Again, there's 2 communication stations in it, and this is you will have a true actors in that stations, and make sure you follow the same. Red is for passively observing stations, and black letters is for your active participating station. So that's about the program. And I want to briefly touch base about the joining instructions. How do we use the Zoom? This is, if you simply click this link, it will take you directly to the meeting. If not, use the meeting ID and passcode. Make sure your audio is connected. And I like all the delegates to rename their name. You can use that in the Zoom app. If you click the participants list, and there is a function called rename, what you can see, and make sure you use your delegate's number. It's helpful for yourself as well as others. For the delegates, use your word D and the number, and for observers, you use OB and put your number. It's quite helpful. Fortunately, most of the delegates are in-house physical attendance. Some of the delegates still still attending virtually, which is fine. As you can see, you will be having multiple breakout rooms, and in the breakout rooms, you will see the 4 square signs. If you click that one, you will see the different breakout rooms. For example, in this one, otology, rhinology. It depends upon which device you use. If you use iPads or Android devices, and the whole button highlights. But if you use a Mac, you have to scroll, which is very important. You listen this carefully. You scroll the cursors all the way to the right corners where you see the yellow arrow. And when you see the numbers, you click that one. Then it changes into the join. Then it will ask you to reconfirm. You have to confirm that again. And then it will take you to the appropriate breakout rooms. If you find you can't switch your breakout room by yourself, it means your Zoom is not up to date, which means you have to go to the main website, www.zoom.us, and I need to download the up-to-date, which is just simply click the resources. You can see the yellow arrow, which is a download Zoom client. It depends upon your Mac or Windows. It only takes 2 minutes to download it. Regarding the screen share, you just need to press the yellow upward pointing black arrow in the green background, and then it will allow you to share your whole desktop or the PowerPoint. You can share it. The faculties are kindly requested to produce those images and videos in the PowerPoint slide so that it can easy to move. If the other faculty want to share, it automatically disengages the previous screen sharer, or you can stop the screen. So I think that is about it. If any concerns, you can always get in touch with us. It's really hard. And the Zoom breakout rooms, Linda, myself will send you some instructions as well. You will see the pop-up messages, particularly which is very important for the timekeeping. I think that is about it.